My name is Dale. I'm from the Physical Therapy Department. I'd like to welcome you to Newman Regional Health. And as part of our orientation, we have the opportunity to spend some time with you to review body mechanics, to review bed mobility, to review walking training with a walker, and transfer training skills. And Trent is my assistant here today, and we are pleased to be able to offer this opportunity to you. Now, why is this really important? Because 90% of all nursing-related injuries are back injuries. And 90% of all injuries, all back injuries, occur while you're transferring or moving patients. And so this will be a review for you, I'm sure, but it's nice to review that because it really will help you to protect your back while you're working here at Newman Regional Health. Okay. Most injuries occur at the end of the shift. They also occur when you try to lift more than you're physically capable of, and also when you're in a hurry to transfer a patient. So those are the main key elements that you need to avoid while you're transferring patients. I'd like to speak with you a little bit about the body mechanics that you'll be using when you're transferring patients. We've all been told to sit up straight and to stand up straight, but really we can't, because as you see in a normal spine, we have a cervical curve, a thoracic curve, and a lumbar curve, and the discs are maintained, and there's the most structure and safety in your back when you maintain those curves of your lumbar spine. And so you injure your back more when you flatten these curves out instead of maintaining the natural curves that are in your back. Now, Trent is going to demonstrate what I mean when I say flatten out your lumbar spine. And what he's going to do is to lean forwards, pick something up off the floor with straight knees. Okay, Trent? Now he's going to do that again, and I want you to focus on his low back. See how it flattens out? That puts his back in a weakened position. Okay, now he's going to do it the right way now. He's going to use the large muscles of his hips and thighs, and he's going to bend down, and he's going to pick that object up using the largest muscles in his body, which are his hips and his thighs, and not the long, weak muscles of his back. Okay, thank you. So to prevent back injury, you want to basically maintain a athletic position with your feet, which is basically one foot slightly ahead of the other, feet about shoulder width apart, so you can move all directions and maintain your base of support with that. You want to avoid twisting your back with a loaded spine. And what I mean by a loaded spine is when you're holding something, like you're trying to transfer a patient or to move a weight, you need to keep the weight in front of you instead of trying to rotate that weight to move the patient. And most commonly happens, let's get the wheelchair, is when you're trying to move a patient from point A to point B with the wheelchair. This is how I hurt my back early in my PT career. I had a patient that was very weak and very large, and I tried to transfer him from the wheelchair to the bed, and I did the thing that I'm asking you not to do. I twisted my spine with the loaded spine. So what I try to do is I try to use my momentum to move him from the wheelchair to the bed. And when I did, I ruptured my lumbar disc right here because of the twisting motion that occurred in my lumbar spine. So that's why body mechanics are really important to help you prevent that from happening to your back. So whenever you are moving, it doesn't matter if it's a box or a patient or something light or something heavy, keep the load in front of you instead of twisting to move the object from point A to point B. Another thing to keep in mind is that the closer you keep the heavy weight to your spine, the less the back muscles have to work. I have a 10-pound weight in my hand. The back muscles perceive it as 10 pounds. If I project that weight arm's length away from my back, the back muscles perceive it as 150 pounds. So if I include that with the twisting motion, where I am moving a patient or a weight like that, that puts a tremendous amount of torque on your lumbar spine, and you're very likely to rupture a disc if you're not careful. Another principle of body mechanics which is very important is to move slowly. move the patient slowly. If you're working on a transfer, moving them up in bed, down in bed, rolling or whatever, move slowly and help the patient know what you want them to do so they can be a partner in that process. I've talked to many patients, and one thing that they hate the most is being moved from one place to another like a package, instead of being involved in the process where they feel safer because they know what is coming and they can help more. They do not like being moved without the opportunity to help you with that process. And if there are more than 2 people working to move a patient, be sure to communicate back and forth so that you know what you're going to do, I know what I'm going to do, and so that we can work together as a team so we're not working against each other as we're transferring a patient. I also like to review another important aspect before you start to move a patient is to basically find out what their prior level of function was. If your patient used a walker at home, make sure that you have a walker in the room and are using a walker with them when you're walking them to the bathroom. If they were in a wheelchair bound, that sets your limits on what they're able to do with you from an upright point of view. So just spend some time with the patient, talk to them, find out what their prior level of function was at home to give you an idea of what to expect from their performance now. The other thing is their cognition and orientation. If somebody is confused and disoriented, more than likely you will need at least 2 people to help safely mobilize that patient, because they could unaware be fighting against you and pushing away from you, causing a safety issue for both you and the patient. So also assess the patient's cognition and orientation. And also a quick and dirty assessment if the patient has enough strength to stand is to have them do a straight leg raise. And Trent will demonstrate what a straight leg raise is now that I'm talking about. So Trent, if you'd like to lay on the bed on your back. Now Trent is going to do a straight leg raise where he lifts his leg up off the bed. If a patient can do that, they have enough strength to stand on their legs without their knee collapsing on them. So if they cannot lift their leg up off the bed, they are going to need help, physical assistance to stand up safely, and they are at a high risk of falling if they don't have enough strength to lift their leg up off of the bed. This is also a good opportunity to interject that physical therapy is not the only ones that mobilize the patient while they're in the hospital. This is a team collaborative effort of all hospital personnel trying to keep the patient moving and strong while they're in the hospital. As a patient lays in bed, they lose 4% of their muscle strength a day. So they could be in the hospital for 3 or 4 days, and then the doctor writes the discharge orders for them to go home, but they have lost so much strength while they're here, they have not enough strength to function safely when they go home. So mobilizing patients in the hospital is a team effort of all hospital employees. The other thing I want you to be aware of is their blood pressure, oxygen saturation, their orthostatic hypotension, etc. Because if a patient has a blood pressure of 88/40, let's say, when I stand them up, more than likely they're going to pass out on me. So that's something that you need to be aware of, the vital signs of your patient, before you attempt to move them. The other thing is to make sure that you know what their current medical status is, their hemoglobin levels, whether or not they have a PE, what medicines they're taking, because all of those things also factor into a patient's safe ability to mobilize. And also take a look at your environment, like we're in a patient room right now. How much space do you have to physically position the wheelchair, to position the walker, to help the patient get in and out of bed? Where are the tubes, the lines located that are connected to the patient? Do a dry run in your mind and with the other person helping you before you get a patient up, so that you do not dislodge the tube or a line while you're trying to safely immobilize a patient.